Thank you,
I
Speaker.
call the member for Bega.
Thank you, Speaker. In New South Wales, Mental Health Month is observed annually throughout October. This year's theme, Let's Talk About It, prompts us all to reflect on our mental health and overall well-being, irrespective of whether we've been personally encountered mental illness. It emphasises the significance of maintaining good mental health in our daily lives and encourages a proactive approach to seeking help when necessary. Mr. Speaker, I'd like to share a personal contribution which I made 5 years ago in my local paper. Quote, 1 in 5 adult Australians experience mental ill health in any year. If you're one of the 80% fortunate enough not to personally experience the temporary or long-term distress of mental illness, you will have had a partner, parent, son or daughter who has lived with this problem at some time. We all have some lived experience of mental health illness. Sharing this common experience reinforces our common humanity and helps us support and advocate for our community. My great-great-grandfather migrated to Australia from Germany in the 1860s. He was a shepherd who settled in the New England region of New South Wales. Following personal trauma, he suffered from melancholic depression and was admitted to Callan Park Hospital for the Insane in Sydney, where he died and was buried hundreds of kilometres from his adopted home. This should not happen to anyone. My father fought in the Second World War in New Guinea and represented Australia as a kangaroo. He became an alcoholic and inflicted violence on my mother in our home. This should not have happened to her, my brother or my sister, or any woman or child. This should not have happened to him. My brother became an alcoholic with mental illness, and after years involving mental health services and services for the homeless, he died prematurely, having lost contact with his family. This shouldn't happen to any man. I have a niece with severe social anxiety which restricts her normal daily functions. I have a wife who has suffered from postnatal depression like more than 1 in 7 new mothers. I have 2 beautiful and loved daughters whose mental health ill health crises have caused them to overdose on medication requiring hospitalisation. This shouldn't happen to any of them. I came to the Eurobodalla 16 years ago. I arrived here suffering suicidal ideation and I've suffered from it since. I've never acted on these thoughts. These fleeting, haunting ideas are shared by 5% of our population. I can now look at trees as things of beauty, but not agents of my fatality. It shouldn't happen to me, but it has, and it continues. None of this should happen to any of us, but it does. What should happen is that our most vulnerable community members cannot access local specialist psychiatric services. What shouldn't happen is that our family and friends with acute mental illness are admitted to hospitals more than 100 kilometres from their home. We need improved primary outpatient community services. We need support for general practitioners, mental health nurses and psychologists. We need youth mental health services. We need drug and alcohol services. We need comprehensive perinatal and early parenting mental health services. We need acute adult inpatients in a level 4 regional base hospital. That's what should happen, end quote. As a consequence, the Bega electorate now has headspace in both Batemans Bay and Bega, which provide free, youth-friendly and confidential services for young people aged 12 to 15. I commend the Minister for Mental Health, Rose Jackson, for the delivery of the Bega Safe Haven. Bega Safe Haven is a calm, culturally sensitive and non-clinical setting staffed by trained peer workers with lived experience of suicidal crisis and mental health professionals to support people experiencing mental health distress. I call on the Minister to establish a safe haven in the Eurobodalla region. I'm pleased to inform the House the new Eurobodalla Regional Hospital will have 4 short-stay mental health beds and a safe assessment room. New South Wales Health wants you to know that you are not alone. Call them for help. For mental health inquiries, call 1800 011 511. This number is available 24 hours, 7 days a week. In an emergency or for urgent help, always call 000 or go straight to your nearest emergency department. You can also contact Lifeline 24/7 crisis line on 13 11 14 for immediate support. I have spoken about it, now let's talk about it.
I thank the member for sharing your personal experiences in such an important issue.